So here's the meat and potatoes of equitaping, the methodology guidelines. We are going to go over these 5 steps repeatedly in this course. You need to learn them, memorize them, love them. They are the heart behind what equitape is. First, the assessment. This is an evaluation of the horse. We are going to dig very deep into each one of these coming up. So right now we're just going to kind of go through them, and trust me, we're going to explain them in depth later. Second, application objective. Each application will live in one of 2 worlds. It's either going to be therapeutic or it will be training. So get your brain starting to focus on everything you've seen. We're going to split it off in 2 different worlds. Your application goal. This is the physiological goal that you are wanting to get out of your application. There are 6 physiological goals that you can get out of equitape. There's more, but in this course, the foundation are the 6: decompression, circulation, fascia, muscle assist, muscle relaxation, and support. The next step is your application techniques, and this is tape cuts, patterns, and protocols. And the last, definitely not the least, very important one is considerations. Basically, this is anything else in the world that can have some kind of determining factor that you may want to think about. Understanding the following methodology is the basis for all successful applications.
So one thing I want to point out with the equitaping methodology, we are training you to be successful equitaping practitioners, but this methodology also complements other modalities. Perhaps you're trained in craniosacral therapy, laser, massage, PEMF. When you are allowed to connect all of these pieces, our assessment process will help you to design an even more effective and successful application.
So the equitaping guideline grid, I highly suggest that you have this with you probably for the next 6 months. I think it helps you visualize how each step can affect either the one above it or the one below it. Also, it will help you put the pieces together when you're out there. And that's because the methodology is designed to answer the question for you as you work down it. On top, we have assessment, both static and dynamic. The objective, again, we have 2 different worlds. You have the therapeutic world and the training world. Pretty much, there are only a couple applications that can be both. And so if we're doing a muscle assist that generally lives in the training world, say you have a horse that is in a physical rehab program and you're assisting some muscles over there, and in that area you could say it's a therapeutic application while in training or something like that, where we can understand that your goal is to live in both worlds. But for the most part, it's going to be one of 2. Support tapings, assist tapings, joint support, biomechanical, that's all going to live in your training world. Horses that are therapeutic, are recovering from an injury or a rehab purpose, this is going to be your relaxation techniques, joint support, swelling, sensory, fascial, all of that's going to live over here in the therapeutic side. Now, your goals affect the objectives you're going to live in, right? So if I know that I have to work on swelling, I can't throw him in the training category. He's got to stay over in the therapeutic category. Then your techniques. We're going to start diving into these a little bit more. These are the different cuts, applications, and protocols that you use. And if you have a horse in training, you're probably not going to be able to use a fan cut because it's just going to come off, right? So that also helps you understand that I've got this horse in training, I'm going to assist a muscle. Well, I'm probably not going to use most of the different cuts. There are only a few that I can use and be successful. And then the last is the considerations, which really will affect everything above it. You know, if we're working on assisting a muscle for a horse in training and it's raining outside and the horse was outside of the pasture and he comes in wet, my considerations are telling me I actually can't put tape on that horse at all. I got to get him dry. So each one affects the one underneath it. And that, I think, once you get your brain working in that process, it will make it easier for you figuring out what to do and how to do it. So let's jump into techniques, patterns, and cuts. In each and every application you do, you're going to use one of these patterns and cuts. The first one is a single strip, and this is just rounded corners. It can be short or as long as you need it to be. The split strip has 2 tentacles coming off one end. That end needs to be about an inch, inch and a half. The spider taping is one of my favorites, very versatile. It's 2 split strips, 2 tentacles, both ends with the middle uncut. Then we have the fan cut. The fan cut has 3 or more tentacles off of one end. And then we go into the basket weave. And this is 2 or more fan applications put together to form a basket. When I say 2 or more, most people kind of look at me like I'm weird, but there are plenty of applications, especially on the legs, that you are going to use more than 2 fan cuts to create the right basket. And then we have the combination taping. And this is when you add a couple different techniques into one application to find the physiological goal that you're looking for. The last area is advanced tapings. We will not be going over advanced tapings in this course, but here are a couple examples of what you can do. Lymphatic work, biomechanical work, covering open wounds. We say there's, don't use the tape over an open wound. These all have the non-stick pads around the open wound. That way these horses can still be mobile, be out in pasture, and be in their normal life. Stifle tapings, and then decompression sensory tapings. We're going to go into this a little bit more for sure, but I just want to bring your attention to some of those really quick.
So now we're going to practice tape cut.
Open wounds, we say there's, don't use the tape over an open wound. These all have the non-stick pads around the open wound. That way these horses can still be mobile, be out in pasture, and be in their normal life. Stifle tapings, and then decompression sensory tapings. We're going to go into this a little bit more for sure, but I just want to bring your attention to some of those really quick.
So now we're going to practice tape cuts. The equitaping methodology has 4 major tape cuts. And so grab a roll of tape and a sharp pair of scissors and go ahead and practice with me. Our first cut is just a single strip. So measure about 3 boxes. You want to crease or bend over the tape, and we have designed the paper backing to have this really handy grid pattern, so it's a lot easier to cut accurately. When you're cutting your pieces of tape, remember to round the edges or the corners of the tape. Now we have our single strip cut with rounded edges, and remember we round the edges because it helps the application adhere better and stay on longer. If you're blanketing a horse, or if they're out with pasture mates, or maybe they might itch on a tree, it really does help that application stay on longer. So remember to always round your edges or your corners. For our second cut, it's a simple split strip. So once you have got your single strip with rounded corners and rounded edges, you're simply going to follow a line in the center of the grid pattern, cutting directly up through the middle of the tape, leaving several boxes or inches from the top so that you have enough to place on the horse, and then you get these fun little tentacles when you're done.
The next tape cut we are going to practice is our spider cut. For this, if you can cut a strip of tape 6 boxes long. So now that you have your piece of tape 6 boxes long, I'm going to have you just fold it in the center. And you're going to make your cut on the rounded corner end. Don't do it on this end or you'll mess up your spider tape. So go ahead and cut in the center. And stop when you're about an inch from the middle. And now you have a perfect spider cut. The next cut we're going to practice is the fan cut. Go ahead and start with a piece of tape 6 boxes long. I'm going to have you fold one end up to the other end. It makes it easier to cut if you are fabric on fabric. It doesn't slip around near as much. And when you're doing this on a horse, this end piece here or your anchor needs to be addressed lengthwise for however long the tentacles are going to be. The longer the tentacles, the longer the anchor piece needs to be. For this demonstration, we're just going to do 1 box. So you're folded up and you can use your lines on the paper backing kind of as a guide to help you cut. I'm going to go ahead and cut 4 tentacles into this piece. So to do that, You're going to want to start cutting directly in the middle. And then you can cut in the middle once more. Last piece, you just lift it back up and you'll cut in the middle. Then you get a perfect, easy to cut fan cut. Equi-taping methodology basics. Here are some very, very important facts to put in your brain as we start going forward and practicing some applications. Why don't you talk to everyone about surface preparation?
Surface prep is critical to every application. You must start on a clean and dry horse. Make sure that the coat is free from any lotions, sprays, oils. I always carry around with me several microfiber cloths, an alcohol solution, witch hazel, and I double check. Even if a horse is perfectly groomed, by the time I get to a barn, I am double checking to make sure there's no dander, there's no dust, that there's no film, that someone wasn't fly spraying a horse a couple rows down and the wind made it blow back on my horse. So always, always double check, is my horse clean and is my horse dry?
Here's an important pro tip. When you are tearing the paper backing, it makes it very easy to just stretch the tape. It just tears so easily. And then when you want to separate the paper backing off of the tape itself after you've already torn it, just stretch it, right? A lot of people, they get in here and they start picking and then they end up touching the sticky. Don't touch the sticky.
Don't touch the sticky.
Stretch it, pop it, don't pick it.
An important thing to remember about the adhesive, it is made to be sticky. So don't tear the paper backing off until you are actually ready to apply that piece of tape, because there is dust in the air, there's hay in the hair, and the longer it stays exposed to air, the less sticky it will become.
Very, very good fact there. Another thing I want to point out is that tape is actually put onto the backing with 10% stretch. So if you are applying an application and all you're doing is paper off stretch, that's still 10% stretch or mild stretch. So keep that in the back of your mind. We talked about rounded corners earlier. We're going to say it multiple times because it is very important. Always round your corners. It will help prevent lifting. It will make a beautiful, clean look. It beds down into the hair better. For Equi-tape, we cut rounded corners. One other really important fact, always use the proper stretch for the application. If you're in doubt, use less stretch. Important tip and fact, both together. Lay down the ends of the tape approximately 2 to 3 inches with no stretch. We never put stretch on the ends of tape. That last 2 to 3 inches is going to serve as an anchor for your application to stay longer and have the recoil in the right spot. So always, always, always make sure you back that stretch off on the ends. Our adhesive is heat activated. It is very important to lightly yet vigorously rub your tape application to activate that adhesive. You might want to be careful that you don't pop an end up when you're rubbing though. Do not tape over infected areas or an open wound. If it is an open wound, you need a non-stick pad between the tape and the wound. And we do not tape over fungus or bacterial infections on the legs, mostly because your tape just won't stick to it, so don't even waste your tape. Applications can be left on horses for multiple days. Each application we do, we will talk about the protocol and about how long you would consider leaving that application on. Some techniques that we want to talk about. The ends of the tape can never have stretch on them. We will go over this multiple times, but it's important that we say that. Your primary ended tape, if you are taping with the lay of the hair, you want to make sure that you apply that primary end with no stretch and no slack. And then your secondary end, if you are taping against the lie of the hair, you want to push back on that tape as you lay your secondary end down, and this will make sure that it sticks onto the hair well without popping its little end up. We will go through this in more detail in each one of our videos coming up. You can overlap tape pieces. You can use anchors to help your applications stay longer. The anchor can be underneath the application or over the application. Both are very effective. We're going to talk about assessment. Assessment is one of the most important parts of the process. So the assessment is everything. It's visual. What do I see? Confirmation, chewing, posture, demeanor. What do I feel? This is palpation, hand on the horse, physical exam. Biomechanical, this is where we're watching the horse freely move or move with a rider or under tack, collaborate. This area, I want you to think everybody. Full history of the horse, maybe from the owner, the trainer, the groom, veterinarian. If you can get the files from the vet, your chiropractors, your farrier, body workers, everybody. The more information you have, the better you're going to be able to help the horse out. And the more you collaborate with everyone in that horse's life, the more they're going to want to collaborate with you. And they're not going to look at you as a threat to their business, like you're wanting to take a client away from them, right? We work best when we're working with other modalities, when we work as a team, when everybody comes together to help that horse succeed. The better and more accurate your assessment is, the greater likelihood that you are going to have success. That's Dr. Beverly Gordon's famous quote, and I can tell you what, I stand by it. You've got to really spend time developing your assessment skills.
All right, let's talk about your application objective. In the equitaping methodology, it's either going to be training or it's going to be therapeutic. Sometimes you may have a combination, but 9 times out of 10, it's going to be either training or it's going to be therapeutic. So on the training side of things, this is where you're thinking about assisting muscles, helping a horse while in work, preventing injuries, supporting joints, ligaments, tendons, and helping a horse while in his training or exercise program. Another important aspect of training is to help speed recovery. If a horse has had a long week at the horse show or he's sore from a workout, putting equitape on him will actually help him recover faster. Another important aspect of the training side of our methodology is think about putting on that application to support a horse while in motion. Now on the therapeutic side of this methodology, we are going to be focusing mainly on helping a horse in a rehabilitation situation. So whether a horse is recovering from a traumatic injury or you're addressing something specific, swelling, inflammation, hypertonic muscles, fascial adhesions, your therapeutic application is likely going to be used when a horse has time off.
Application goals. This is when we're talking about the desired physiological outcome. What are those goals? We're going to say it over and over. Remember them. They are what will guide you through the process. You have decompression, circulation, support, fascia, muscle assist, and muscle relaxation. Each time you go to put an application on, if you always remember, what is my goal? My horse that I'm working on, his back is tight, spasming. I need to relax the back. Easy. The goal is muscle relaxation, and that will tell you exactly how to tape it.
Application techniques are going to be critical for your success as well. Equitaping applications and techniques are specific for each physiological goal. Techniques for any given application will consist of a chosen set of variables. So this means start thinking about everything that's going to influence whether your application is successful or not. Where are you going to place your pieces of tape? Where do you need to measure? Where is the primary end going? Where is the secondary end going? How much stretch do you need? What direction of recoil are you going? Are you trying to assist a muscle? Are you trying to relax a muscle? Think about the adhesive. Remember, it is heat activated. So on one area of the hair, you might need to rub it a little bit more to activate that adhesive. Think about your skill, your expertise. What have you gotten from your assessment? All the considerations on the table. All of these variables are going to determine whether you have a successful application.
One of the things that I like to bring into consideration is when we talk about the adhesive characteristics. If you're out taping a horse in sub-degree temperatures, that's a big consideration to think about. And we talk about this a little bit more, but I wanted to bring it up now because you may have to keep your tape warmer. Or if you're taping in the middle of summer and it's 115 degrees outside, when you lay that application down, I mean, it's going to stick like glue right away because it is heat activated. So that's always something to consider. Where am I taping at? What's the temperature outside? Am I going to need to activate this adhesive form or not? That actually moves us right into considerations. I would say, arguably, one of the most important parts of the modality. Considerations will include everything else in the world. This is follow-up care, post-treatment protocols, factors that we don't initially think are going to affect the choice of the application we may choose. So what do I mean by that? Like, can the horse remain in work? That's an important consideration to think of. I have a training application on a horse, so I'm going to assist a muscle. Can that horse stay in work? Yeah, sure he can. This horse was in training and he came out of the pasture and now his leg's swollen. I have to do a circulation application. Can the horse stay in work? No. This is where we want your brain to start going with considerations. Other things that I would say you need to start considering: when should the tape be removed? Should another application be put on? If another application is necessary, will you be available to come back and do it? If not, can you teach someone there at the barn to do it? Maybe a groom, maybe the owner, maybe the trainer. Those are all things that you're going to have to think about, especially if it's something like that swollen leg. It may need 3 or 4 applications. It may resolve in one. So always thinking about what that next step is. I always tell people it's something they don't think about very often, but is your horse in turnout with buddies? It's amazing how much they like to pull the tape off of each other. Is your horse being blanketed? Most of the time, the people throwing the blanket on the horse are not caring much about your tape application. So bringing special attention to that. Those are considerations, and I think you'll get better at the considerations as you tape a horse, and then in 2 days it comes off because maybe your considerations weren't quite up to speed where they should be. Other things you are going to have to deal with are owners, trainers, other body workers, vets, farriers. I like to get in the habit of building my case studies just like we're going to teach you here, but continuously doing it so I can hand off exactly what I've done with the horse, what I feel like is a great follow-up, and that way those vets and chiropractors, body workers, they can collaborate with me. The owners are on the same page. Everybody feels like they are in the loop. Things to think about as well here is guarantee you are doing good surface preparation, that you come prepared. You do have alcohol and microfiber. You can tell your client all day long, please make sure the horse is clean and dry, free of lotions, oils, silicones. If it's slippery, please don't put it on the horse. And I promise you, you will show up to work on a horse and they will have just fly sprayed. And if you aren't prepared, you're not going to be able to tape the horse. So think about some of those things. A lot of people like to pre-cut, especially for fetlocks. They get in the habit, like most fetlocks are going to fit within this block radius, so I'm going to pre-cut. Inevitably, you are going to show up to tape a horse and they just bought a draft and they want you to tape their fetlock, and all you have is pre-cut strips. You're going to be unable to help that horse. Another thing that we really have to deal with is market price. We get asked this every course. Okay, how much should I charge for my session? Well, it depends on where you're at. It depends on what your other credentials are, what's your skill level at. Right at the end of this course, you're probably not going to feel like you're ready to go out there and charge for a full session of a kinesiology session. It may take you time to build up that confidence to do it, but I definitely say look at your market and see what your area can handle. Ask other practitioners that may be around you or in similar states. You know, you can't charge the same thing in Wellington, Florida as you can in Kansas. The people just aren't going to pay it. That's something to think about as well. And how much does it cost you to do that application? How much tape are you going to use? What other supplies are you going to use?